Now that we've talked about the main causes of burning feet and the foods that silently damage your body, let's move into some of the most effective things you can do to actually reverse or significantly reduce the pain, heat, and numbness you may be feeling. And we're going to start with one of the simplest but most underappreciated tools in your toolbox: movement. For older adults, especially those over 50, circulation becomes less efficient. Blood vessels narrow, arteries stiffen, and if you're not regularly moving your legs and feet, that blood can't flow the way it used to. And without good circulation, your nerves don't get enough oxygen or nutrients. That makes the burning worse, but you don't have to become a marathon runner. In fact, too much intense exercise can sometimes flare things up even more. What you want is something called therapeutic movement. These are gentle, controlled exercises focused on improving blood flow, mobility, and nerve function. Simple ankle rolls, toe raises, calf stretches, and walking on your heels or toes can wake up sleepy nerves and loosen tight tendons. Try standing up every hour for just 5 minutes and walking around the room. It seems small, but if you do this consistently, day after day, it adds up. Use resistance bands to stretch your arches and massage the bottom of your feet using a ball or foam roller. These tiny movements help encourage fresh blood to nourish the nerves. Over time, you'll notice less stiffness, fewer cramps, and often a drop in the burning or tingling sensations. Now, let's talk about supplements. Supplements can be incredibly effective if used properly. But here's the truth: most people are either taking the wrong ones, taking too little, or not giving them enough time. Nerve healing is slow. Your nerves regenerate at less than a millimeter per day. So when you start a supplement, you need to give it at least 3 months, ideally 6, before deciding whether it's working. One of the most well-researched supplements for burning feet is alpha-lipoic acid. This antioxidant helps protect nerve cells from damage and improves insulin sensitivity, which is important for anyone with blood sugar issues. The recommended dose is usually between 300 to 600 milligrams per day, taken with food. Some people may get mild heartburn or nausea at first, so start low and build up. Another big one is acetyl-L-carnitine. This amino acid compound helps regenerate nerves and increase energy production in cells. Several clinical studies show its benefit in diabetic neuropathy and chemotherapy-induced nerve pain. The typical dose is 1,000 to 2,000 milligrams per day, split into 2 doses. You can also combine this with CoQ10, especially if you're over 60 or take statin medications, which can deplete CoQ10 levels in your body. CoQ10 supports mitochondrial health and energy production inside every cell, including nerve cells. B vitamins are absolutely essential for anyone with burning, tingling, or numbness. Focus on a methylated B complex that includes B1, thiamine, B6, pyridoxine, and B12, methylcobalamin. B1, in the form of benfotiamine, is particularly helpful in reducing nerve pain. Studies have shown it helps reduce symptoms in diabetics within 12 weeks. B6 is useful, but in high doses over time, it can actually cause nerve damage. So stay under 100 milligrams per day, unless under medical supervision. B12 should ideally be in the methylated form for better absorption. You can take it sublingually or in a spray form. If you're severely deficient, your doctor may recommend injections. Magnesium is another vital nutrient. It helps calm the nervous system, reduce cramping, and improve blood flow. A common dose is 200 to 400 milligrams per day, preferably in the form of magnesium glycinate or citrate. Avoid magnesium oxide. It's cheap and poorly absorbed. You can also soak your feet in Epsom salts, which provide magnesium sulfate through your skin and also ease tension in your feet. There's also curcumin, the active ingredient in turmeric. This is a powerful anti-inflammatory compound and several. Studies have shown it can reduce nerve pain when taken consistently. The key here is bioavailability. Curcumin by itself is hard to absorb. Look for a supplement that includes black pepper extract, piperine, or a liposomal version. Many people in India get over 2,000 milligrams of curcumin daily just from their food, and they tend to have lower rates of nerve-related pain disorders. So start adding turmeric to your soups, teas, and stews, or consider a high-quality curcumin supplement. Now, let's talk about creams and topical solutions. For many people, especially those with very localized pain, a topical cream can be a game changer. These work fast and have fewer systemic side effects compared to pills. One of the most popular options is capsaicin cream, made from chili peppers. It works by depleting a substance in your nerves called substance P, which transmits pain signals. Apply it to the bottoms of your feet 2 to 3 times a day. At first it may sting, but with continued use, most people notice less burning over time. There's also menthol-based creams like Biofreeze or herbal blends that use camphor and eucalyptus. These provide a cooling effect and can distract the brain from deeper nerve pain. Try rotating between warming and cooling creams to see which works best for you. Another effective technique is contrast baths. This means soaking your feet in warm water for 3 minutes, then switching to cold water for 1 minute. Repeat this cycle for 15 to 20 minutes, ending with cold. This can improve circulation, reduce inflammation, and help desensitize overactive nerve endings. Do this once daily or a few times a week as needed. If you've tried all of these and still aren't getting relief, there are new therapies being explored that may help. For example, there's a patch treatment that uses high-dose capsaicin. It's applied in a medical setting and left on the foot for about 30 minutes. Some patients report up to 3 months of relief after just one application. There's also electrical stimulation therapy, where tiny electrical impulses are applied through pads to your feet. This helps rewire how the brain processes pain and can improve nerve communication. You might also hear about spinal stimulators. These are tiny implants that deliver electrical signals directly to the spine to calm down overactive nerves. While these are more invasive and typically reserved for severe cases, many people report major improvements in symptoms. Even more cutting-edge are red light therapy and infrared treatments. These use specific wavelengths of light to stimulate circulation and reduce inflammation at the nerve level. You can buy these devices for home use, but make sure they're medical grade and use the right wavelengths, usually between 600 and 900 nanometers. Use them 10 to 15 minutes a day, focusing on your feet, ankles, and lower legs. Now, let's talk about shoes, because what you wear every day has a massive impact on your nerve health. If your shoes are too tight, too flat, or lack support, they can compress the small nerves in your feet and worsen your symptoms. Invest in shoes that are wide enough, have good arch support, and a cushioned sole. Avoid going barefoot on hard floors. Instead, wear supportive slippers or sandals with arch support even around the house. Orthotics, or custom foot inserts, can also help correct poor foot alignment, which takes pressure off compressed nerves. I've had patients walk into the clinic with what they thought was diabetic neuropathy, but once they wore the right orthotic and shoes, their pain dropped dramatically, sometimes within days. Let's bring it back full circle. Burning feet aren't just a random nuisance. They're a signal your body is trying to tell you something. Whether it's your blood sugar, your circulation, a vitamin deficiency, or poor mechanics, there's always a reason. And that means there's almost always something you can do to improve it. Whether it's changing your diet, moving your feet more, taking the right supplements, or just putting on better shoes, each small step can help your nerves heal. It takes time. It takes consistency, but it's possible. You are not stuck with this forever.